In this module, I'm going to talk about the different ways that you can engage GPs at a contractual level. So once you've got your GP and you want to sign them up, the different ways that you can do that. But I do have to read you a disclaimer before we go any further. So so take careful note of this. You must obtain your own legal advice. This is not legal advice. So Headspace provides this information as a suggested resource only. This resource includes information of a general nature only and is subject to recommendation that the lead agency should seek their own legal and tax advice as to whether it is appropriate for the particular circumstances, and they are, importantly, complying with all relevant legislation.
The delivery of that was fantastic.
I was going to say we'll have the words up there, but actually no, I think we'll have you.
Yeah.
All right. Good.
But maybe just get your own legal advice.
Yeah.
Yeah?
So, get your own.
Can we get those sound effects too?
So in terms of contracting options, there's a couple of things to be mindful of. So the first is the Health Insurance Act 1973. So unless the Minister otherwise directs, Medicare benefits are not payable where the service is rendered on or behalf of or under an arrangement with the Australian Government. Because that is the situation that we are in, we are not able to salary GPs if they're generating MBS income. That will be viewed as double dipping. So that's the first really important legal principle that drives the different options available to us. So in terms of the contracting options with respect to the contracts between Headspace Centres and the federal government, there's two things to be, two take-home messages. One, salaried staff cannot bill under MBS, and two, staff that, people who are providing a service under MBS must be engaged as private practitioners. So they're the two general principles.
Should you do one again and then do two? I don't know, two was a bit like waffly, but one was really concise. Is that alright?
Just do it again.
Okay, I'll do it again. So in terms of the contracts between Headspace Centres and the federal government, the two principles in relation to MBS is that federal funds provided to salary staff mean that those salaried staff can't generate MBS items, and the other consequence is that that means that they have to be engaged. So people who are generating MBS items must be engaged as private practitioners. So that's the general principle to ensure that there's not double dipping.
Cool.
Is that all right? It's a bit, you know.
Good.
And I guess we need to run that past Julie to see if we need to even talk about that, or if that's now so far away from what we give advice about, because it is really not our advice at all. So again, in terms of the contracting options for engaging a GP, there are three options. So one is private practice. So that will be the main option. So that a GP is engaged as a private practitioner in order to generate their MBS revenue stream. The second option is that there is an option that they can be employed for any work that they are doing for which they cannot generate an MBS item numbers for. So this might include things like working on policy, working on projects, attending team meetings, doing supervision. So these are things that they can't claim MBS items for. So this leads to another option, which is a hybrid of those. So you might have a GP engaged as a private practitioner for the bulk of their time, and that's while they're engaged in their clinical work seeing young people. But then you might also supplement that either as a employed, salaried or unsalaried, to do the other activities for which they can't claim MBS.
I found that last point a little bit, I couldn't follow that. So if you supplement that, so you should do that bit again.
Yeah.
Yeah.
A hybrid one again.
Yeah. So there's a hybrid option where for the bulk of what the GP's work is that their clinical work seeing young people, they can be engaged as a private practitioner, but they may also be engaged, employed even to do work that they cannot generate MBS items for, so that you actually they're doing both, and it's a hybrid model. Is that better?
Yeah, it's good.
So how many people would fit into number 2?
Not many.
Like none, basically.
Oh, no,
So
no,
you're
there
not
are
working
some.
with GPs then?
Sorry? No. So, for example, the couple of GP clinical leads, so the GP clinical lead role is an employed role.
Ah, got ya.
Yeah, they're not seeing any patients during that time,
Yeah.
but they're working on projects, they're supervising, recruiting, da 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 da.
Yep. Cool. Okay, that makes sense. That was good. So that was all contracting. So that was the end of the video, I think. So that just a little short one.